So hopefully we'll have access to PowerPoint at the end of the presentation. I can actually send you, email me. I'll give you my email address and I can email you the slide. Okay. All right. And then, okay, let me share this again. I'm hoping that the other people who was lost can be able to find their way back. Okay. So this one, we're done with the, okay, with the walking speed. So you know that the walking speed right now is a factor for whether or not you are at risk for falling. So what are the complications of fall? Of course, if you're a therapist, you know fracture is one of them. 90% fall accounts for 90% of hip fracture, hip and wrist fractures, and 60% of head injuries. Okay, it can result to mobility impairment, disability, dependency, social isolation, psychological problems, including the fear of falling, anxiety, loneliness, and depression. So this fear of falling is actually, when I went back to school, this is a new concept for me. I saw it in the clinic. I didn't know that it is called the post-fall syndrome. And around 1/3 of the people develop the fear of falling. And they say this is actually more debilitating than the fall itself. I have had patients who actually will like shake and lean backward when you try to stand them up or ask them to stand. They really have this increased risk of fear of falling, that they don't want to stand up anymore. Okay, so, and that can reduce their ADL, loss of self-efficacy. It means ability to manage themselves or their condition, self-confidence, activity avoidance, lower quality, and increased institutionalization. And you may lose your independence, and it can increase the burden of care. Some of our patients who actually, what do you call this, went to SNF, skilled nursing facility, to rehabilitate after the fall. Unfortunately, some of them are not actually capable of going back to where they were before, okay, because of the fall, the pain, the surgery. And if you top that with the fear of falling, it's too much already. Okay, so for the posture, okay, let me see. Do you have any question? We have, okay, Roberta. Oh, Roberta is the one who asked about the PowerPoint. Okay, you're welcome. So this is a good education for everyone. I always tell my patient, as we grow older, everything goes south. So as you can see, the posture of this is my model, my friend. So ideally, when we stand up straight. And we see a lot of people, older adults, standing up this way. And in therapy, we have the one that bends the joint, okay, are the flexors. So at the on the leg, the back of the leg here, this is the hamstring. It bends your knee. And in front of the hip is the hip flexor. It bends your hip forward. And we have the feet are actually very confusing because it's both flexor, but one of them is actually extensor. So the back is, we call the calf muscles or the plantar flexors. And the front is the dorsiflexors, but it actually like an extensor for a flexor, sorry. Dorsiflexor is like a counterpart of the wrist extension, but the representation of the body is different. Okay, so the flexors get to be tight and the extensors get to be weak. So the extensors are the muscles at the back that makes you stand up straight. The hip extensors are the muscles at the back of your hip. The knee extensors are the one making the knee straight, and the dorsiflexor is the one moving your ankle to point up. So these extensors are actually getting weaker, okay? And the flexors getting tight. So if you really want to improve your posture, there is a very simple rule. You stretch what is tight and you strengthen what is weak. That's the basic rule, okay? So if you want to reverse this position, so this is just for the turn, just in case I use it, so you know what I'm talking about. So if the toes are pointing up, we call that dorsiflexion. And if the toes are pointing down, we call that plantar flexion. Okay, so these are the calf muscles here at the back of the leg. All right, so when we walk, ideally, I'm not gonna bore with the entire cycle, but this is my focus, the heel strike. Okay, so when we walk, the toe should be up, the heel should be the first one to strike the ground. That's why it is called heel strike. Now, if your calves, so I always, since I cannot stand up and you cannot see me, guys, so I always, let me grab your full attention here. All right, stop the share. Okay, so I always tell my patient, if this is your leg, your foot, and this is your leg, if this is your calf muscles, you know, so if this gets tighter and tighter, what it will do is it will like pull your whole body backwards, you know, because it's at the back of your leg. So it will pull it backwards. So the tendency of your body is to actually lean forward to counteract the pull. So guys, if there's one thing that you would actually learn from tonight is I want you to remember that it is very extremely important for the calf muscles to be flexible. So if you're an OT, you have to talk to your physical therapist. Do you think the calves are tight? So in clinical setting, guys, I don't know if you had seen therapists saying to the patient, all right, sir, you know, we're gonna stand up, but the patient was leaning back and then they cannot put their feet underneath their knees because the plantar flexors are very tight. So, and once they're standing up, they are leaning too far back. And once they're standing up like that, they are leaning back, and the therapist will say, tuck your bottom in, stand up straight, you know, move your hips on top of your feet. That is not gonna happen if the calves are so tight, unless you stretch the calf muscles. The patient will lean back so far backwards, and they are not able to really regain the balance until they are, you know, holding onto the walker and leaning too far forward to counteract the pull of the calf muscles. So I wish I can have a wide range here of camera so I can show you what I'm talking about. But basically, this muscle here, the calf muscles, so the action of this muscle is to move your toes forward, down, sorry, to point your toes down, okay? So if it is too tight, it's hard for you to really stand up straight because of the pull of the muscle on your foot is backwards. So I have actually a theory that people without any back problems, osteoporosis, or back deformity, and they're starting to really have a posture that is like hunched over. They're starting to be hunched over when they're standing. I can bet you that their calf muscles are tight. And majority, if not all of my patients who have fallen or have impaired balance is that their calf muscles are extremely tight, moderate to extremely tight. So it's really important because, guys, you have to remember the feet is the foundation of our balance. The feet is the foundation of your posture. So if there's an impairment or imbalance of the muscles around the ankle, if this muscle is pulling your toes to be pointed far forward down, but here you cannot see it's pointed down because you are putting weight on it. So the tendency of this muscle is to pull actually from the top, so your body will have a tendency to lean back, okay, to compensate, because of the pull of the muscle. And as a compensation, you're gonna lean forward and be hunched over because your calves are tight. So there are research studies out there that actually say that the limitation of dorsiflexion, or the ability to point your toes upward, if it is limited, is an indication of a fall risk. So as a physical therapist, if I see someone, observation, I can tell whether the patient is a fall risk or not. If they don't have this, okay, where is that? If they don't have this, instead at the initial part of stepping is this is what will happen, this is what happened, or their toes are too close to the floor, it means that the calves are too tight. It's pulling your toes to point down. So you don't have good angle of the toes and the floor. So the lesser the angle during initial part of walking, it means that the calves are tight and the patient is at risk for fall. Does that make sense, guys? Okay, let me see your reaction there, if that does make sense. All right, okay. All right. Yep, okay. So I'm glad it makes sense. So if there's one thing that I can guarantee you guys, if you, right now, if you are a therapist and you can actually stretch the calves of your patient, that will create a lot of good for their balance. If you haven't tried that yet, this is something that you can do next week, Monday come, and see how the dorsiflexion of your patient, or you can assess yourself also. If you stand up and try to tap your toes simultaneously at the same time, and you cannot have a good clearance of your foot doing that, it means your calves are tight. Okay, so there are so many ways to stretch the calf muscle. There's so many ways, but as we know, exercising is not of the best thing that our patients wants to do or anyone to do. Okay, so I always make it a point to make it simple. So the simplest that I can think of is having, if it is really tight, is having like a 2x4 wood, and I ask them to place it near a countertop for support, on the floor, have their toes up on the wood or the board, and they must keep everything straight. Tuck their bottom in, their tummy should be tight, everything is straight, and as much as possible, if you can hold that for both of them at the same time, that is better than 1 foot at a time. But if you cannot hold that position, both feet up on the board at the same time, then do 1 foot at a time, okay? So, but this is very effective, simple way, and hold it for 30 seconds to a minute, 3 to 5 times every day, just like brushing your teeth, you have to do it every day, or at least 3 times a week, 3, 4 times a week. The better you stretch it, the better your posture will be. Okay, so there are other people who might be more flexible and they want to do this against the wall, near the door frame, that your toes are against the wall, and then you move closer there, and you can feel the stretch. But everything, the key here is to keep everything aligned. Everything should be straight. No leaning forward, no, everything should be straight from your neck, head down to your toes. Okay, keep the knees straight for a better stretch. So again, should be done 30 seconds, a minute, 3 to 5 times a day. That's enough. Okay, the longer that you hold it, a minute or two, the better. And actually, I was surprised because in Amazon, they actually have like wedge board. Some of them have, it's almost like a reading board that they have, like you can adjust the height of it. Some of them are just like fixed wedge board that you can use for this. But I don't advise my patient to buy anything if they don't want to, and just use a thick book, heavy book, or a board for this, for the simple exercise. And I'm kidding you not, this is a very effective exercise to start off to improve your balance. Okay. All right. Next one. Okay. So this one is one of the most, this is my favorite exercise. And some of you might know this. This is bridging exercise. And I even asked my 90-year-old patient to do this. If you can remember the posture, the normal posture, you see this part, the buttocks is bent forward. So the meaning the muscles here are stretched. Okay, the muscles are stretched, so they are weak. And you have to reverse this position in order for you to go back to a straight position. And one of the best way to reverse this position is through this exercise. So I actually asked my patient, this is like a bedpan exercise, Imagine that someone's gonna put a bedpan underneath your buttocks. So this is, so you lay down, your feet flat on the ground, bend your hips, bend your knees, okay? And then put your hands on the side, tighten up your tummy, tighten up your buttocks, lift it up, And actually, I learned also from, recent school studies that one of the best way to actually know the strength of your hip extensors or the buttocks muscles, or maybe you heard like gluteus maximus, is to do a bridge endurance test. And the bridge endurance test is just practically like this. You ask the person to do a bridging, and the normal for that test is 176 seconds, almost 3 minutes for people with no back pain and healthy individual. So that sometimes I use that as a goal for my patients. I will test how long they can hold their this position and record it, and then next time assess if it gets any higher or they're able to hold it for a longer period of time. So this is one of the best exercise, and I even do it myself because I know the benefits of it. Okay, so I love this exercise. And unless you have any pain or any contraindications, the doctor told you cannot do this for some medical reason, then don't do it. But if you do it without any pain, without any contraindication, this is one of the best exercise you can do for yourself. All right. Now, we always walk forward. So basically in our hips, we have three major muscles. The muscle in front of your hips, the side of your hips, and what we just discussed about back of your hips. So since we always walk forward, the front muscles of our hips are the one pulling it forward. It's always active. But the back muscles, we rarely walk backwards and we rarely walk sideways. So the back muscles of the hips and the side muscles of the hips gets weaker and weaker also, because we don't use them, we don't stimulate them. And this is one of a practical way to strengthen up your side muscles of your hips or the hip abductors. So you have to remember, if you're gonna do this exercise, you have to be straight laying on your side. So the hip should not be bending forward or backward. It should be aligned to your body, and then lift the leg towards the ceiling. If you don't like this exercise on sideways, on laying on the floor or the bed, walking sideways is good. If you're going out for a walk, walk sideways to the left and to the right. You know, that's a great way to strengthen this muscle. Some of my patients who are strong enough to have a band around their, above their knee, and they walk sideways with it. It's one way to strengthen up those muscles. These muscles at the side of your hips are important for balance. So they are the one holding your pelvis up while your other leg make a step. So if the side muscles of your hip are weak, your balance is really poor. Okay? So, and this is one of the most neglected muscle also, even in therapy. Okay, so we have to be aware that these are important for balance, and the more strong these muscles are, the better the balance of a person is. Okay, and another one, very important exercise is for the back. Okay, so if you have a stoop posture like this, the back of your back muscles are weak. So this is one of the many ways that you can exercise the back of your the back muscles. Okay, having a band, okay, tying it around a pole or a ring, and pulling it backwards. For us occupational therapists, this is one best way to strengthen the back muscles so that we can decrease the hunch position or posture of the patients. Okay. All right. Do you have any questions so far, guys? Let me see the chat. So bridge is mostly for core strengthening, correct? It can be core, but it's also buttocks, gluteus maximus, back extensors and hip extensors strengthening for your back and for your hip. The muscles that straighten up your back at the lower portion of your back and the back of your hips, bridging is best for that. So if I have a patient with low back pain, and if we try that without any pain, I encourage them to do it. So basically we do it like up and down, and then if they can hold it for 3 seconds, great. If not, then just do up and down. And then the longer that you hold it, the better your back will be. Okay? Do you have any other question about the back before I jump into the next one? I think we have very few minutes left. Okay, so crossing the leg, is that good or bad? Any answer from you guys? Anyone still here? Anyone still listening to me? Okay, it's bad. Okay, thank you, Roberta. So bad for your knees, yes, bad for your knees, and it's bad for your hips as well. You remember about we're exercising the side muscles of the hips. It stretches the side muscles of the hips, and any muscle that is being stretched is getting weaker and weaker. And the muscles inside the hip is getting tighter and tighter. And you can see this on patients with that is just wheelchair bound, and they always cross their legs. And when they stand up, they are knock knee. And it is basically they were stretching the muscles at the side of your hips, and they're tightening muscles inside your hips. So you're gonna be standing with your knees bent and knock knee position, and guess what? You can easily fall with that kind of posture. Okay, so it's a bad idea. And actually, I also read a study, a research study, and it's in the book. I forgot what research study, but they found out that when they take the blood pressure of people with legs crossed, it's higher than when their legs are not crossed. So it can increase your blood pressure. The only rational reason that I can think of is because there's a big artery, the popliteal artery behind your knee, and you are impeding the blood flow. That can increase your blood pressure, you know? So that is a bad, if you are habitually crossing your leg, that is a bad idea. And you have to stop now and do the exercises to strengthen the side muscles of your hip. Okay, so this is the chair lift. Is this a good one to have or not? Any comment? Okay, very good, Barb. No, not unless absolutely needed. Great, I think so. Roberta, okay, here's the thing. The people had an idea that this is good because some hospitals have this. And for me as a therapist, if you had like heart surgery or previous, and you are so weak, you cannot push yourself up, this is good. But if you use this on a daily basis, this is a bad idea. Basically because you're not using your legs and your core to push yourself up. So, and the machine is doing that for you. Remember, as we grow older, our muscles get weaker already. And then you're not using it. On top of it's getting weaker, you're not using it. It's being lazier and lazier. And then guess what? People that I have who has been using this have been falling many times than people who are not using this on a daily basis. Okay? So this is a bad idea. Run away from it. Don't use it. If I always tell my patients, if you still have the ability to push yourself up, do it. And don't rely on the machine, because eventually it's not a help. It's something that will make you fall faster than any other person your age or the same condition, if that makes sense to you guys. Okay, so I am like, the manufacturer of this should make a sign that this can cause muscle weakness in a long run. Okay, I don't like this machine unless it is medically necessary, and people are using it for convenience, and that is where the problem starts. Okay, so we talk about, should you choose a walking device? No, you should consult a therapist, because walking devices should be measured based on your height, so that you will not develop this posture because it's too low, or you're not using it properly because it's pointing the wrong way, or people using this rollator don't know that it has a brake, how to brake it, that they should put the brake before they sit on it. So accidents can happen. Therapists should be the one prescribing the device, okay? Instead of buying it, if you're not a therapist, and buying it on your own and trying it for yourself. This one is the worst kind of rollator I've ever seen. Okay, I don't like that one. Okay, now when should you see a therapist? If you feel like you're unsteady, you lost your balance, you have near misses, near fall, frequently tripping over, you have difficulty going up and down the steps, you're feeling weak, and you are hunched over. So I always tell my patient, our body gives us small warning signs. If we do not listen, it will make us listen. Okay? And the common myth is, leave me alone. I'm 80 years old. There's nothing you can do. Okay? Falling is part of growing old. Nothing will work. The only explanation I give my patient is your muscle still alive? Is it still working? Are you able to kick? If the answer is yes, then I have hope for you. Okay? So the only thing that stops you from getting better is the thing between your ears. Okay? So if you are open enough, okay? If you are open enough, then there's something that can be done. What population information be used? Maybe family member should be. Just go to rehab. Older adults, you start from 40 or 50. 60 years old, these are good information that they should have before they really grow older. Going to outpatient department or a senior center with full education will be good so that they can have useful information. Roberta, if that answers your question. Okay, so we're running out of time. So I want to close out with this. We do not stop exercising because we grow old. We grow old because we stop exercising. So that is from Dr. Kenneth Cooper, American doctor. So this is a good way of saying everything, that exercise is not just for the young. It is most especially useful as we grow older so that we will decrease the risk of falling. This is my email address. You can jot it down. And then I made this group, Stay Sharp, Fall Not, Just Upright Community. You can add yourself there. And we can stay connected, and I will announce there the free classes, or you can message me at my Facebook account, Jean Ruder. I have the website, justuprighttherapy.com, and I have a YouTube channel. So, and if you can, subscribe to that, it's free. That will be cool. All right, so these are some of the references. Thank you so much for watching, and remember to hit the subscribe button below. It is for free for the latest video updates. Thank you for your support and stay blessed.